What if the voice inside a patient's head isn't a mental illness, but a cry for help from a failing liver or a starving brain? Welcome back, residents. Today we are breaking down the metabolic and nutritional cluster. This is the internal poisoning group. We are looking at what happens when the brain is either being drowned in toxins from organ failure or starved of the essential fuel it needs to function. As always, we use psychosis as the fever, the metabolic sign is the anchor. Let's get into the 4 high-yield categories. Number 1. Acquired organ failure. This is what we call the encephalopathies. When the liver or kidneys stop filtering, the brain pays the price. If your patient is psychotic and you see jaundice or a flapping tremor, *, that is hepatic encephalopathy. Check the EEG for triphasic waves. If they have uremic breath, hiccups, or muscle twitching, check the creatinine. That is renal failure. And here is a rare one. If they have intense abdominal pain and a spike in amylase, think pancreatic encephalopathy. Number 2. Nutritional deficiencies. The brain is a high-maintenance organ. It needs its vitamins. Thiamine deficiency, or B1, is the big one. If you see the triad of ataxia, eye signs, and confusion, that is Wernicke-Korsakoff. You have to treat this immediately with IV thiamine or the psychosis becomes permanent. If you see the 3 Ds, dementia, diarrhea, and dermatitis, that is pellagra or niacin deficiency. And keep an eye out for B12 deficiency, also known as megaloblastic madness. Look for a sore tongue and numbness or tingling in the hands and feet. Number 3. Inborn errors of metabolism. These are the genetic glitches that usually show up in younger patients, but they can masquerade as schizophrenia for years. Acute intermittent porphyria is the little imitator. If a patient has abdominal pain, peripheral neuropathy, and their urine turns dark red, you have the diagnosis. If a young person has a schizophrenia that is rapidly followed by a motor decline, screen for metachromatic leukodystrophy. If they have vertical gaze palsy, meaning they can't look up or down, that is Niemann-Pick type C, and always remember Wilson's disease. If you see Parkinsonism and liver issues, look for those Kayser-Fleischer rings in the eyes. Number 4. Other metabolic states. The most common and most dangerous is hypoglycemia. Neuroglycopenia looks exactly like a psychotic break. If they are sweating, hungry, and tachycardic, do a finger prick glucose test. It is the fastest cure in psychiatry. Also, don't forget starvation. In severe anorexia, the brain literally hallucinates food. Here is your clinical takeaway for the next time you are on call. Psychosis plus a flapping tremor? Liver. Psychosis plus a sunburn-like rash? Niacin. Psychosis plus dark urine? Porphyria. Psychosis plus sweating? Glucose. Stop guessing and start looking for the anchor. You aren't just a psychiatrist, you're a brain-body detective. If you found this breakdown useful, hit that like button and subscribe for our final clusters. We're covering the toxic and genetic clusters next, and you won't want to miss the signs for those.